The most difficult and stressful thing is having a patient that you know end their life. I don't think there's anything within psychiatry which is as difficult as this. And when I've experienced it, it was probably the hardest period of my life even. Because you get this sense of guilt. What if I had done this? What if I had done that? Maybe I could have done this. Maybe I could have, I went by the book, the book says that I'm supposed to do this. That's what I followed, but still this patient ended their life. Is it my fault? Is it the book's fault? You start to, disbelief in what you do or how you do it or the system, everything. It's a very, very difficult thing to go through.
Like, that's a different level of trauma. I don't think, I think that's something that you have to be in it to experience that, and to understand or empathize with how psychiatrists deal with that. And
it's actually very interesting because I was traveling and I was in Colombia, and I remember I was chatting with a friend, and then I told her that I've been through that and it was the most difficult period of my life. And obviously at that time she was like, oh, I'm sorry to hear about this. And then we just met a week ago after I came back from my travels, and she had a friend pass away through suicide. And she was like, I just remembered you, and this is how I feel right now. And it's like the most difficult feeling I've ever had. And I blame myself, and it's a friend, not your patient.
Yeah.
So yeah, it's a very, and I mean, I guess, in surgery and medicine, the feeling is probably the same if you have a patient pass away and all of this. But suicide, I think, is the most.
We did we briefly spoke about things that the viewers can do, if they have a friend who sort of they might feel is suicidal or might need help. But we have obviously we've all done medicine. We know about basic life support, and a lot of the public is promoted and is pushed. What basic life support is, how to administer it, young and old, everyone seems to know, most people know anyway. Is there something similar to that, but from a mental health point of view, in terms of, for example, suicide? Obviously that would be, if we were to do a comparison, illnesses of the body and illnesses of the mind, suicide would be sort of, the on the spectrum will be sort of the highest. Is there anything we can sort of the public can take away, the viewers can take away, that a 5-step point or something that they could sort of remember to do in a situation, for example, in a patient or someone that they know might be suicidal?
I mean, it's very tricky to. So there's, my understanding is, and I might be wrong, I know that there's a lot of people are getting mental health training now, especially in companies and things like that, which is a very, very important thing. And I hope to, be able to promote that one day. I would always say never take the risk, really. If I'm feeling someone's acting in a very different way from how they were before, you've got the NHS. It's an incredible system, honestly. And I'm not saying this because I work in the NHS. There's a lot of problems within the NHS. But I think in terms of mental health, it's a very good system. Honestly, even when you compare it to private, because we get a lot of private patients, who have seen private psychiatrists, and you see the difference, because the NHS, you've got the community team, you've got the home treatment team, you've got the hospitals. It's a very, all the system is combined together. So there's a proper system. While if someone sees a private psychiatrist, for example, there'll be an issue with the inpatient, or there's not that system, or there's no home treatment team, things like that. But I would say don't take a risk. Always, if there's any doubt, either call 111 or go to A&E. That's the only thing you can do. But don't, there's nothing that this person can do to kind of stop this, but they have to kind of get the right support.
I think that summarizes it well, to be honest with you. I think that's a very good takeaway for our viewers as well. I think especially the point you mentioned about not taking risks. It's always, don't try and sort of be like a hero, or if you don't brush it under the carpet. Again, there's a lot of sometimes we're unaware, or we might take it lightly, because obviously we're not, the importance of mental health is not sort of promoted within society. But it's very important to if you feel a friend, or you feel yourself, or a family member, a loved one, or whoever they may be, you notice that someone might have these suicidal thoughts, might be thinking about taking their own life, to try and just refer them, try and get them help as soon as possible.
Yeah, always get professional help. Don't kind of take on yourself.
Yeah.
You know, if I have abdominal pain, I'll go to A&E. You know, I'm not a surgeon. I'm not expecting to do anything. I have to go to the right place straight away. Don't take risks, basically. Yeah.
And to be honest, sometimes we just need to ask.
Yeah.
It's actually profound. Like the phrase "How are you?" I think that needs to be expanded upon, and actually someone sit down and say, look, how are you? Is everything okay? How have you been? It's not just you're passing someone in the hallway and you say, you're all right.
Yeah,
you just nod at each other. Yeah, you're all right, mate. And then the other person doesn't even reply, how is it? He just says, you're all right. And it's not even a conversation. Like, just sit down with someone and they pretty much 10 times out of 10, they'll open up with you. If you spend time with anyone, everyone just opens up because everyone's going through something in life. And
you reminded me of a very interesting story. I don't know if you've heard of this Facebook group called Tea and Empathy.
No.
So I was in a conference in 2016, I think. It was my first year as a core trainee. And this lovely, I think she was a psychiatrist, and she herself had mental health issues, and she spoke about them in a lecture, which was one of the best things I've ever attended. And she said that as an F1 or F2, she was doing ward rounds, and she had like a family situation similar to what you were saying. She had like a very difficult family situation, and then she, I think, had to, like, work was extremely stressful during that time. And she said that for the last like 3 weeks she was feeling really mentally drained and really unwell. And one of the cardiologist registrars she was referring a patient to left her a note with his number and said, I can see that you're not doing very well. Would you like to have a cup of tea? And then she went and she spoke to him, and then he asked her to get some help, and she got some help, and then she was able to actually complete her training and do all of this. And then that's when she set up this group called Tea and Empathy, where people say if they're struggling, especially doctors. And then now in some hospitals, they actually have this where, if you're on call and you're stressed, there's a number to call, and then someone would come and have a cup of tea with you.
Okay.
Which
that's a very good initiative.
Yeah. It's definitely worth it. Yeah.
Definitely. Yeah. That's very important.